Right. Well, good morning. It is 11 a.m. I think we should go ahead and get started. Uh, Karen, if you don't mind keeping keep an eye on the lobby to let people in, if you don't mind. Um, all right. So just a few reminders, everyone. First of all, thank you for being here. And we're going to try to make this as informative and efficient as possible since you are all aware that this is not billable to the Ryan White program. So again, thanks for participating. This video, this training or in-service is being recorded, so we will have this video uploaded to the aidsnet.org website probably, shortly after the meeting. So if your colleagues are not here, they can access the trainings online. And as a matter of fact, all of the four trainings that we've had this month are already posted. And that you can find that in the MCM Hub in aidsnet.org and just scroll down to or just click on trainings and it'll take you to the calendar, and then you can click on any Wednesday. Actually, you don't even need to click on the date. You'll just see the videos. Um, as a reminder, while the presenters are speaking, please be sure that you are mindful of your microphone. Um, and generally be mindful of the microphone throughout the in-service. Okay, we don't want to disrupt anybody while they're speaking. Also, although this training is not mandatory, I do think for the purpose, this type of venue is somewhat impersonal. So I do believe that having the cameras on makes our presenters feel better and ensures that everybody's engaged. So if you wouldn't mind putting on the camera, I would really appreciate that. And I'm sure our presenters would as well. So again, thanks for being here. Thank you for your time. For the presenters who are with us this morning, thanks for putting this together for us. I do appreciate it, and I'm sure everybody on the call does as well. We had a fabulous turnout this month, and hopefully we can develop and present more in-services for everyone, especially since we don't have, what we used to have, which was our monthly training. So let's go ahead and get started. As you can see from the agenda, Angela Machado, Associate Director at SFAN, as well as Belen Corro, SFAN Eligibility Specialist, are here to talk to us today specifically about outpatient ambulatory health services specialty care referrals. So presenters, just be mindful of your time. You have 20 minutes to present, and that should include questions and answers. So audience, please be mindful of that. I don't mind extending the meeting at all, as long as everybody's okay with that. So if we have a lot of questions, I think now would be the time to address them, so I won't interfere with that flow or that process. Um, we want to definitely make sure that you get the most out of this as you possibly can. So let's go ahead and get started. Angela and Belen, thank you for being here. I will stop sharing now so that you can share your PowerPoint. Okay?
Okay, thank you, Sandra.
You're welcome.
Let me share. Let's see how this is going to work because I'm not familiar with.
I have your presentation as well.
Okay, yeah, because I'm not familiar with Teams.
No? No worries. Okay, let's see what we can do.
Let me close some of the stuff I have. Sorry.
Okay. You want to give it a shot?
Yeah, we're
Okay.
getting ready now.
No worries.
Do you see anything?
Yes.
You just want to
Yeah.
start your presentation from the
Okay.
beginning?
Yeah.
Yeah.
I just wanted to make sure that.
We see it.
Okay. So good morning, everyone. Like Sandra
Angela,
mentioned.
swap the views maybe.
Oh,
It says display setting
Yeah, I think display settings.
on top yep.
Yep. Swap presenter view.
Can you see the
There we
slide?
go.
Now it's
Yes.
perfect.
Okay.
Mhm.
Okay. Again, my name is Angela, and I'm going to be sharing with you some of the specialty care referrals. Let me go to the beginning. For the Ryan White program, from RA and here at Jackson. So basically, all specialty care referrals, as you all are aware, because a lot of you have been working either directly with Belen or with Peggy. These referrals come through Provide Enterprise. And then again, they review the referral for accuracy and documentation. Any documents that need to be added to the referral should be uploaded as part of the actual referral that is sent to Jackson. The process is basically, like I mentioned, they're reviewed. If the referral is approved, the medical, any medical specific information is sent to the appropriate department for review and assisting with appointment scheduling. Like I have either Belen or Peggy or even myself at times, we do review all of the referrals that come in through Provide. There is certain information, as some of you are aware, that needs to be included with these specialty referrals. The last 2 clinical notes, last 2 completed labs. The labs should include all those specifics are mentioned there. Again, depending on the specialty. A prescription list, all the medications that the client is on, and any imaging, if that is available, again, depending on the specialty. Again, I want to say, I do want to mention that if you need guidance, if you have questions, you can definitely please reach out to us, and we have those contact information at the end. For dental specialties, so dental referrals also have dental specialties, such as endodontic, oral surgery, periodontal. All of those require that the case manager attach the order from the dental provider and most recent labs, especially if they are coming from the outside providers, and for us that means the Ryan White community providers. For all in-network referrals, the Jackson disclosure form must be included to be able to issue the Jackson financial card, which is either an IO4 or an IO2 to receive services. If you do not have that Jackson disclosure, you can reach out to Belen or myself or even Peggy, and we can provide that to you. Most of you, we've shared that with a lot of the case managers, so most of you should have that. So if a referral is rejected, there's different reasons for a referral to be rejected. And number one, of course, if the diagnosis is not listed in the Miami-Dade County Ryan White program allowable medical condition, that referral is going to be rejected. It could be that there was no physician order attached or clinical notes. There was no disclosure attached. you, the case manager that submitted that referral, will receive a notification as to the rejection of the referral and the reason. I have a little note there that if the client diagnosis is not listed in the Ryan White program allowable medical condition, we can assist with what we call the secondary code, which is the Jackson Prime code. There is different requirements for that for the client, and again, Belen can also assist with that. Some of these, this information for the secondary code or the Jackson Prime code of documents is listed in the Jackson website under financial assistance. You can see the address there. But again, if you go to the Jackson website under financial assistance, you can also obtain the list of the required documents if you want to share that with your client. All the information in the website is in the 3 languages, English, Spanish, and Creole. Like I mentioned, Jackson Prime Code uses different guidelines for eligibility and requires more documentation than the Ryan White program.
The question.
Yes.
If a prime code is needed because the diagnosis isn't listed, are you stating that, does that mean that a case manager is referring specifically? No, well, that wouldn't make sense. I mean, essentially, a case manager is believing that they're referring to Jackson for a specialty care service with the intention of it being covered by Part A. So if it's not, because there isn't the required documentation, how does the case manager know that a prime code will be provided versus the Ryan White program paying for the service?
So that will be part of the comment for the rejection.
Okay.
And we can we definitely include as to the reason why it was rejected. If the client still needs the service, they can get the service, but they would have to go through the Jackson Prime code.
Does the case manager need to do?
Qualify.
Does the case manager need to then advise the client to go to Jackson to do this, to complete that process, or is that something you do internally automatically?
We can again, we can assist with that since the client is part of the Ryan White, and the case manager can reach out to Belen, and she can basically assist with that.
So it has to be directed by the case manager after a rejection is received.
I mean, the reason why I'm saying the case manager is because, again, the case manager basically is managing that client's health case. So it will be in the best interest if they don't to explain that to not only to the client, but also to reach out or provide the client with the contact information for Belen, and the client can reach out to Belen directly.
Okay.
One of the two.
Okay.
I know, I mean, we get a lot of calls from clients saying, and I'm just going to give you an example because I got one today. Client has a Ryan White referral and is calling us for us to assist with to book an appointment. We don't do the appointments. SFund doesn't do appointments. We provide the appointment line information, but I know that that this is something that I don't know if the case managers in other agencies are aware that we as SFund do not provide appointments for the client. Then again, Hold
I
on.
have a question.
I was going to say
Hold
there's
on.
a few
Okay.
questions. Do you want to address them after your presentation,
Yeah,
Angela?
yeah. Yes,
Okay.
please.
Okay.
Thank you. So specialty care referrals, so appointments, depending on the specialty, appointments are requested in different ways. We do have, like I mentioned, the appointment line, which is a 305-585-6000 or 305-585-4564. Also, appointments can be requested via the website, and I have that in there at https jacksonhealth.org. Request an appointment. We can definitely we are able to assist with certain specialty appointments, and Belen can definitely assist with that for those outside clients coming into Jackson. And we don't mind assisting. That doesn't mean that the client's gonna get an appointment right away, because that's not the process that Jackson has. A lot of our specialties only meet certain times per week. We don't have controls of those appointments. We have to reach out to those areas to assist with appointments, but we can definitely assist. Again, I have the contact information for any referral specialty. You can reach out to Belen. Her phone number is there. Her email is there. And a lot of you have done so in the past. If you're not able to get in contact with Belen, you can definitely leave a message. She will get back to you as soon as possible. If she is out, her backup, like as I mentioned, is Peggy, or you can reach out to me directly. So now I'm going to take questions.
Okay.
Before you
I've
do
got a
that, Angela,
question.
I'm sorry, George, one second. Angela, can you put Peggy's phone number in the chat and your number as well, if you don't mind? Okay, sorry, George.
Wait, hold on,
Okay.
George. There was a question in the chat before you raised your hand. I'm sorry.
Okay.
Don't kill me. Tabitha wanted to know how often does the Jackson disclosure need to be completed?
Belen,
The JMH disclosure form.
yeah, Belen,
Can you hear me?
Yes,
Can you hear me?
yes, we can
Yes?
hear you.
Okay. The Jackson disclosure is going to be needed every time the Jackson card. Well, good morning, first of all. The Jackson card is going to be expired every time the client's case expires. So let's say that the eligibility for that client expires in December, and we have already done that expiration, that card for that client before, and you have submitted a referral, and we did that card until December because that's when the eligibility expires, then you know that a disclosure is needed again when you renew that eligibility. So it's not annually, it's not because you sometimes you don't send a referral, once a year, or sometimes you send a referral every 6 months, every 3 months. So it's gonna vary. So let's say that I reject a referral because I don't have a disclosure, then you know that that card has expired because we don't have a referral from before. So the card is going to be um, um, good until the eligibility expires. So that's the way to know when you need a new disclosure. So that's the best way to do it. So to me, in order for you not to be counting when the eligibility expires and all that, if you have a copy of the disclosure, just put it in. you know, every 6 months. It would be a good idea to do so.
Belen, do you have a link to that disclosure form, or can you send me a
The
copy of it and I can
disclosure,
send
the
it out?
disclosure form is in the forms. When you go into the Jackson forms needed for the secondary code,
Where do you
those
find that link?
that is in the the one that has the link for the secondary code documentation that Angela, I think is in the third
Is
um
under
slide.
Jackson, on the Jackson website, when you go to
Mhm.
financial assistant, the Jackson disclosure is there. We can also provide you with one, Sandra, and you can send it out to
Yeah,
all the
I can
agents.
send I can send the link and the form so everybody has
Okay,
access to both if you'd
okay.
like.
I'll send you, I'll
Okay,
send you
cool.
the form.
Thank you. All right. I think we have a question, George, and
Oh,
then do
yeah,
we have any others?
just a scenario. We have a doctor and the client comes in with some sort of dermatitis. The doctor doesn't know exactly if it's HIV related or not. So we send a referral as diagnostic. Would that be approved? Even though the doctor doesn't know if it's HIV related?
When that happens and you only send the order, it's good to send the clinical notes. That's why for specialties like that, you should send, like in the first slide, that is saying to send 2 clinical notes, the labs, and all that information. It's good to have that because that way we can review it, and then if we can review it further and then determine if it's going to be approved or not. But just the order by itself is not going to tell us much. So that's the reason specialties request the last 2 clinical notes, the last 2 labs, the medication list, in order in order for an approval to be given, and also for them to be able to approve the appointment.
But I don't know if that's answering the question, Belen. From what I'm understanding,
So, okay, so
it's
let
not
me,
clear. Yeah, it's not clear if it's HIV related, even though it's a diagnostic.
Well,
so
So,
one of the,
sometimes what happens, Sandra, is that they send the order by itself, and we don't have any other documentation. So sometimes it makes it clearer if it's HIV related or not if they send the clinical notes. Because by reading the clinical notes, we may approve it reading the clinical notes might be a better understanding of what's going on and may be approved. But if by sending the order by itself and say, sometimes it's not enough. That's what I'm trying to
so
say.
I'm gonna add to that. A lot of this information is sent to those specific specialty departments, and the physicians themselves review all this information. So, and they will communicate back to that provider that is referring that client as to the reason if they can be seen or if anything else is needed. Does that answer the question?
Oh,
um,
somewhat.
Okay.
I mean, I
So
would
again,
imagine, but Angela, I would imagine that if you're the primary and the primary doesn't even know, and there are clinical notes that maybe those notes are given to a case manager and it's still nothing is clear despite the
well, the
documentation. I
other
think
thing,
I think
my,
the
my other,
question is, can we refer for specialty if that diagnosis is not on the allowable medical conditions list, even though it's being sent for diagnostic?
no.
you cannot.
Again, because again, that's the reason why there's that list. I know that I've seen providers of that send the order for specialty, but they add in the diagnosis to rule out certain things, and we do accept that, because again, they want to make sure that it is ruling out the reason as to why they're being referred for additional again for kind of to for additional information as to the reason why the client is presenting with a certain diagnosis. And I've seen a lot of that. They do include to rule out whatever diagnosis that might be. And we do approve those specialty referrals, and we do send them to the to that appropriate specialty for the physicians there to actually review everything. And again, they would reach out to the provider directly as to if they will be seen by that specialist or not. That's all that we are able to do.
Okay, I mean, just because I know the service delivery guidelines, they mention if it's diagnostic, you don't really have to choose one of those allowable conditions. And it says that you will definitely need to have an allowable condition for ongoing treatment. So I noticed that the PE
That is correct.
enterprise does not ask you for allowable condition under diagnosis, but it does for treatment.
Yes.
Correct.
And a lot of the ones for treatment specifically, they go, if we approve it, they go for further approval to the county.
Correct.
Any other questions?
Nothing in the chat?
Tabitha had her hand up earlier, but she lowered it. So I don't know if that means that her question was answered.
It was. Thank you.
Okay, honey.
All right. Well,
Okay.
thanks, Angela. I appreciate it. Thank you, Belen. It's good
Thank
to
you.
see you. It's been a long time. Okay, so you, Ange, will send me the link and the document. I'll make sure I send that out to everybody. And you put your contact info in the chat for Peggy and yourself? Yeah, okay. I don't know if she's muted. All right, well, thanks for your time. We
Yes.
appreciate it. Awesome.
Yeah.
And again, if
you.
there are any questions that come up, are you guys going to stay on the call or are you going to log off?
I have to drop off because
Okay.
I have something else. But again, if
You
there's
too?
any
Okay.
questions,
Well, we'll get
if
them to
there's
you.
any specific, yeah. Thank you.
All right. Thank you, Angela. Thanks. Thank you. All right.
Okay, bye.
Bye. All right. We have somebody who is not muted. I don't know, Annie, that sounds like your voice, honey. I'm not sure. All right, so next up on the agenda, we have the Miami Beach Community Health Center that will be presenting specialty care referrals as well as health insurance services. So I am going to go ahead and share their presentation. I'll start from the beginning. What display do we see, Frank?
Oh, you got to swap them.
Yeah.
Swap 'em.
There you go.
Now?
Yep.
All right. Okay, so welcome Miami Beach. Jose Ortega, I don't know if you're here. Welcome.
Here.
Ileana, hi.
Good
Pepe
morning.
and
Pepe's here.
Sandrine. So thank you for being here and thanks for putting this together. We're excited to hear from you guys. So you just tell me when to click on the next slide and I'll be happy to do that for you.
Good morning, everyone. Can you hear me?
Yes.
Okay, good morning. I'm Ileana Lulo, the medical case manager supervisor for Miami Beach Community Health Center, and I'm going to be presenting the referral process for primary care and specialty care services at Miami Beach. So the Ryan White referrals for primary care and specialty care services are received by Miami Beach Community Health Center on a daily
Oh, shit.
basis.
Sorry.
It's okay. It's okay. Through the Provide system.
Okay, step 2. Okay.
A specialty medical care Ryan White and network referral should include the physician referral with an allowable medical condition from the Miami-Dade County program allowable medical condition list. All referrals are approved by Pepe Sayas the day after they have been created and Provide, unless a stat request is received. Miami Beach produces a list of referrals on a daily basis and approves those that meet the Ryan White program requirements. The medical case manager will receive the approved referral back through Provide Enterprise for further intervention. If the approved referral is for a provider at Miami Beach, for example, like PCP Dental, endocrinologist, the client and the medical case manager will need to call Miami Beach Appointments Department to make a first-time appointment. On the appointment date at Miami Beach, this is for the first-time appointment, the client must arrive an hour and a half before the appointment time to complete the registration process. The client must show a picture ID document, provide a hard copy of the Ryan White referral and the physician referral if applicable. Once the client is in Miami Beach database, any referral created in the future will be added to the client's dental medical record automatically. This means that the client will not need to provide a hard copy of the referral each time after initial appointment. If the client arrives to the first appointment at Miami Beach without appropriate documents, the employee attending registration will call Pepe or myself. They'll call our office for the client's information. If any medical case manager or supervisor have a question or concern regarding the referral process or a specific case, Pepe Sayas can be reached via email. There's the email. Thank you.
Any questions? Karen, I'm on mute. I can't see if the screen. Can you ask them if they've?
George has his hand up. George?
I just want to take this opportunity to thank you guys and Pepe especially for making the process so easy and to receive the authorization in such a quick, like the day after. So I just want to thank you guys.
Thank you so much for saying that. Okay. He's here. Any other questions?
Yes. Who else is that? Someone's got their hand up.
I think Raphael had his hand up.
I think it was Raphael. There's so many people on the call.
No, I'm sorry.
Oh, you didn't want, okay. Understood. No more questions, Sandra. Let me check the chat.
I unmute.
You're not now.
Okay.
Yeah, there's no questions in the chat either.
Okay. All right. Great. I can't see myself on the screen here. So, okay. Well, thank you, Ileana and Pepe. Appreciate it. Next up is the information to be presented by Miami Beach regarding the Health Insurance Services Program. So just let me know when to go to the next slide, okay?
Okay, I'm here, by the way. My name is Sandrine. I don't know, some of them already know me from a long time. Some of you may not. But I manage the health insurance billing process and payments for the clients that are enrolled in the health insurance program for GAP and private insurance, as well as COBRA. Oh, we can go to the next one. Yeah.
Okay.
So I just went over that already, but just so for the health insurance assistant, there's two different major categories. There is the limited assistance with private insurance, which is usually employer sponsored or at a premium under COBRA. The others are the gap enrollment clients that are enrolled through ACA from the marketplace, or which are getting much more assistance than the other two. And the next one. Of course, this has to be HIV related. I don't do the enrollment, but I know that if there is a family plan, to make sure that only to include the client that is HIV, it has to be indicated or separated. Okay, there is one thing. I think some people might be a little confused about the in-network referral for health insurance. We don't really do health insurance referral anymore. That used to be back then when we used to have the other system. But we do check the eligibility in the system, which is in the health benefit. And this is sufficient enough as long as the eligibility is active and that the client is currently active with the health plan through ACA. I know there was some confusion about that. That's why I'm bringing it up.
I have a question, Sandrine, unless you want to address it at the end. Which would you
Yeah,
prefer?
let me
Okay.
finish and then we can go over everything. I might have the answers, I might not have them, but we can go everything at the end.
Okay.
I know that the medical care messenger must submit to me a copy of the claim EOB confirming the deductible amounts, the drug copay, the medication is usually submitted by the pharmacy for the drug but it has to be in the Ryan White drug copay formulary. The pharmacy, in regards to the pharmacy provider, we only have our pharmacy and the mail order. I don't have that many. It's usually Express Script and CVS Caremark. All the claims for the medical visits, deductible labs, and diagnostic can be emailed to the email that is indicated below. In an encrypted email, possibly, because we will have more than one person checking those emails if necessary. But when a client brings you an invoice, make sure to send it to that email instead of a fax, preferably. And that's it for that.
I know, can you hear me, the group?
Yeah. Mm-hmm.
And I recognize you want to wait until the end, Sandrine, but I just want to be clear for everyone on the call that this slide has nothing to do with ACA. This is a slide related to employer-based insurance for clients requesting deductible or prescription drug copayment assistance only. So do not get this confused with ACA. Okay, so in terms of an in-network referral, there was some discussion with Miami Beach regarding whether or not a case manager needs to generate an in-network referral for health insurance services. I guess, Sandrine, because it's not a service that is requested often, you probably don't see many of them, and we can clarify that at a later time. But again, just to be clear for everyone, this slide has nothing to do with ACA enrollment or ACA assistance with the GAP card, okay? All right, next slide, Sandrine.
Yes, please.
Okay.
Okay, the client enrolled in the ACA marketplace and eligible for Ryan White ACA GAP card must scan a copy of the ACA acknowledgement form into the provider PE enterprise. There is
That's
somebody not.
It's Rosalie, it looks like.
Can you mute them?
Let's see if I can.
I'm sorry, Sandrine.
That's okay.
Anybody at Care Resource, please?
I'm trying.
There we go. Thank you.
I'm just gonna read it again just to make sure. I was referring to the client enrolled in the ACA marketplace that the plan and eligibility for Orion White ACA gap card must be scanned in the in Provide. And the reason why I'm saying this is because sometimes I do check that. And sometimes if an override is needed, I need to have that in place so that because the county will look at that to see if it's uploaded, and then they won't approve it if it's not uploaded in the document section. In reference to the claim and invoices that can be sent to the, I'm sorry, the claims may be submitted to me. I check the ACA acknowledgement form in Provide that the client is enrolled in the ADA Premium Plus and that the eligibility is current. You can go to the next slide. Okay. Okay, yes. The eligibility for this component extends to ADAP clients with income below 50 and 400 of the federal poverty level for 2025. For HIV-related, comorbidity-related, and complication of HIV treatment-related condition only. Part A does not assist with the premium, anymore. Those are paid by ADAP. For 225 plan, Part A has limited ADAP, Part A ACA wraparound assistance for the approved plan. There is about 62 plans, I believe, if I'm not mistaken. So and those are indicated in the guidelines from Miami-Dade County. That's it.
All right.
Any
Any
questions?
questions? We have George has a hand up.
Yeah.
Thank you, Sandrine.
No problem.
I guess I was a little confused, like Sandra, about, so does Miami Beach Community Health Center help clients who have insurance with their employer for the copays?
No.
No, I'm sorry. The Miami Beach Community Health Center does help the clients that have health insurance with their employer for deductible. Let's say they have a deductible. We can assist with that as long as the deductible or the plan of the client is in network with the client's, primary plan. That's what we can assist. If they have private insurance, we can assist with the drug copay and their deductibles. Just to clarify, as opposed to ACA.
So no copays, no office copays.
No office copays but we do assist with a drug copay and any deductible if there are any, and it's in network, of course, with the primary plan or the provider.
I'm sorry, I'm still a little confused. I don't know what a drop copay is.
What do you mean a drug copay? You don't know what a drug copayment is? A prescription drug copayment.
I know what a copayment is, but they say you don't pay for copays, but drop copays.
You don't pay for office visit copays.
Visits.
They're
Medical
not covered.
Copays. There is, let me just say it again. There is different copays. You have the medical office visit copay and you have the drug copay. If the client has insurance through their employer, then we do assist them for the drug copay, pharmacy copay, and for deductible. But we do not assist them with a medical copay assistance or labs and diagnostic unless it's a deductible. I don't know if that makes more sense.
I thought you said drop copay, but you drug copay.
No, drug copay.
Okay.
Any other questions?
Is that
because
clear?
I know.
That's clear, George? Your face is like
no. I think
because
so.
I've got
It's not
clients
clear.
that have because I didn't know about this. So I've got clients who have insurance with their employer. What about if if ADAP is paying their
Then no.
This
is
the
for
third party,
this-
the third party
no.
co-payment.
Hold on.
So this is right. So this is for individuals whose, let's say you have a client with private health insurance and their employer does not accept a third party payment from ADAP, for example. So that client cannot enroll in the ADAP Premium Plus for their premiums, but they still have co-payments for their prescription drugs. In those cases, you can refer the client to Miami Beach for drug co-payment assistance, as long as those medications are on the Ryan White program drug formulary. And then those clients would need to get their meds if Miami Beach is in network with their plan, or Express Scripts or CVS Caremark can be used for mail order. And that was what Sandrine was mentioning earlier, that there's 3 pharmacies generally that they work with, one being their own, but that Miami Beach would have to be in network with your client's insurance.
George, you seem a little confused. So if you have other question, let me know. I can try to clarify as much as I can.
Because when I've had a client who has a copay, and I've always gone to ADAP, and so I thought ADAP is one who's paying for the copay for if they have, private insurance or.
Okay, well, if they are employer insurance, they're not through ADAP. I mean,
Okay.
is paying for drug copay.
Well,
Okay.
Well, they can, Sandrine. The explanation is you have a client. Okay, here's a scenario. You have a client that has insurance through their job. Okay, job place insurance. And sometimes they don't accept third party, which is what ADAP would do. So in order to get that third party, you would have to go to your employer, your human resource, and say, hey, ADAP is going to pay for this. Some clients don't want to release that information to their employer for whatever reason. So they don't, or they go to the job and the job says, oh, we don't do third party. So either you're going to have to pay the copay or not. So that's one of the cases. If they don't receive it from ADAP, they can receive it from you. So that's for George. So if you have a client that's already receiving copay insurance from ADAP, you will not call Miami Beach. If they do not have that drug assistance copay through ADAP, then you're able to go through Miami Beach and get it. Does that make sense?
It has to be, as long as it's in the formulary.
As long as the drug is in the formulary,
Yes.
correct. They have to be in the formulary, correct.
No Botox.
Oh, well, you know what? You're hilarious. Hilarious.
okay. Karen, you had a question earlier for Sandrine. Do you remember?
My question was about the referrals. So I think you covered it, but I think I'm a little concerned at the fact that if the case managers don't have to do it because no one's receiving that, we should be able to say you don't have to submit a referral. But if they are required, this would be the platform to say, hey, in order to get this, you have to submit a referral. So I don't know how you're going to address it later. Maybe you'll send an email once it's clear.
Yeah, I'll speak with Sandrine and Jose and Pepe after the call to get some additional clarification, I think, just to not create any confusion. But we do know that, Sandrine, if you do accept a claim, for example, you're still processing it if you verify in the system that the client is eligible.
Yes, because I mean, even the private insurance, like we were talking earlier, not the ACA clients, the case manager has to complete the health benefits, and they, instead of put it ACA, they're going to put it as employer. So that's what I go based, and the system doesn't stop me to enter a claim if, because it's up
It's
to date on the
documented, yeah.
eligibility. I know that before they were asking for the referral for health insurance in general, but for the health insurance, there's no need. And I think so that was mentioned by the county, because I do remember that it was sent out that there was no more referral for health insurance, and the only thing they had to actually do is the checking the eligibility status and making
Okay.
sure that the client was up to date, and then making
Hmm.
sure that the health benefits is completed, as ACA
Mm-hmm.
or as employer or COBRA, because I'll know if it's
Mm-hmm.
employer sponsored, and if it's COBRA, I will also see that ADAP is paying as COBRA for
Right.
the employer.
Correct.
So it will
Yeah.
show that because ADAP is also involved in those
Mm-hmm.
fields.
Mm-hmm.
So I can see that. So that's the reason I don't see. I know that there's
You don't
no
look
more referral for health insurance. I mean, I've never, maybe I've seen some because they
mm-hmm.
just made it, but I don't need it.
Right. I
Mm,
know
okay.
years ago we would generate a referral to Pepe for ACA assistance for the
Premium.
copay.
Uh-huh.
We stopped doing
Right.
that. Um, so I mean, I know there is a way to generate a referral for health insurance services
Yeah.
and provide it is an option. But
Hmm.
again, just to be not to create confusion, we don't have to review that now. I remember yesterday, Sandrine, that you wanted to make a statement or say something about when you receive statements versus an invoice or a
Invoice.
claim. Do you want to
Okay.
use this opportunity to
Yes.
clarify that?
Yes.
Okay.
Basically, I do receive a lot of statements, which sometimes doesn't have enough information. So I cannot process those because it doesn't reflect the date of service, but only outstanding balance. It doesn't have like a diagnosis for me to determine if it's a copay or deductible. So for me, some statements have, but sometimes I get invoices, statements with an outstanding balance, but I have no information. So I cannot process those. So those are the times that I need a detailed invoice with all these requirement, because same thing that Jackson was mentioning, about the medical notes, for the diagnostics, for example. Sometimes it's not clear. I don't know if the diagnostic is related to HIV or not. So sometimes I ask for more information, because I know the county is going to ask if the client got injured. That comes out, it's not HIV related, but it doesn't really, sometimes the invoice doesn't specify or doesn't. So I need this information. Uh, I will ask for it. Usually I say, I cannot process because I do not have enough information to process the claim or the invoice.
Right. Great.
I know
Do
there's going
we
to be a lot of questions. I don't know, but that's okay.
do we have any additional questions for Sandrine? Anything in the chat? Oh, great. All right. Well, if we don't have any additional questions, we're right on time. I want to thank everybody Miami Beach for presenting, and for everyone participating today. And again, I will send the county a copy of the agenda and a list of all of you who are attending, just in case you ever need that for the future. And hopefully, as I mentioned, we will be developing a few more in-services moving forward, and I'll keep you all abreast of that. And finally, this video will be uploaded to the aidsnet.org website under MCM Hub. And if you have any additional questions, feel free to reach out to me, okay?
One thing, Sandra.
Mhm.
When you guys talked about the diagnostic testing and not needing a referral, George, you did mention what's on the allowable conditions. That's referring to routine medical diagnostic testing. So you know that if you don't have to have, you should, but that's on the allowable conditions list. It's in that gray area at the top. But there are other conditions on the allowable medical conditions that would say to rule out this. So I understand where Angela was coming from as it relates to needing a referral and needing more information as it relates to whether this is HIV related or not. So those of you that may not have looked at the new allowable medical conditions list, the not the care and treatment committee, but the medical care subcommittee, they just updated and edited that area. So if you have not looked at the allowable medical conditions, I think it would behoove all of you to just take a look at it, read the gray area at the top, and it will give you a clearer understanding.
Can you project that, Karen, please?
Yeah,
Let
here
me
it
stop
is.
sharing.
You see it? We need to make it bigger.
You can make it a little bigger. You can do full
There.
screen. Go to that one above that. Go down up to the thing that. Let's
Why
see,
am I
Emma.
blind?
I think you can press Control L.
You know why? Because I have this, there it is.
There we go.
But now it's small. Can you see it?
Mhm.
Okay, so this is the gray area that I was referencing. So there was some back and forth as it relates to the doctors that sit on the medical care subcommittee. So we addressed this very intentionally as it relates to how the diagnostic testing should read. And it was questionable regarding the routine medical versus regular diagnostic. So there's a lot of other treatments that are listed here that are not routine. So they would require a referral for diagnostic treatment, but you would have to know whether or not it's HIV related at some point coming from the primary care provider. So I know that you mentioned this, George, but again, I think you guys should really pay attention to this because it was recently updated. So that's that.
Can it please be emailed, please? Thank you. Just to make sure we
Yeah.
have it.
Karen,
Yeah,
that
we'll
was
do it.
from. Is there any one more recent than 2023?
There is. That's just the one I pulled up.
Okay. Oh,
But
so I
there
can
is one.
email.
It's one from 2025, like May, I think, 2025.
Okay, I can
Okay.
email that out to everybody. No
We'll
problem.
send it.
All right. Any other questions? All right. Well, thanks for everybody being here. Be well, and we will see you again soon. Bye.